Welcome to another episode of the All-Star Veterinary Podcast. We will discuss veterinary things, All-Star as a business, some different shenanigans. We'll watch some funny videos, and you guys will get to see our reactions at the same time, and then we'll answer a listener question or two. So please send us your questions. We can see the comments right here on the Facebook, and so we can answer those. Where you can catch our podcast on Facebook, Spotify, everywhere else you get your podcasts, right? iTunes, that's a thing.
And who are you?
I'm Katie Ray.
And I'm Dr. King.
I'm Dr. Katie Ray.
Yes, you are.
Just kidding, I'm not a doctor.
Since you've been texting your mom, does she know that we're live on?
Oh, hi, Mom.
Does she know
shout
that
out
you're?
to Patty Ray.
Does she know that you're on there? You need to text her really quick and tell her.
She said, I'll have to think about
it. Is
it.
You know, we were sitting around because we wanted to make sure we had a very interesting topic for the live podcast, right? Because this is like live, and so we're like freaking out a bit and getting a little nervous. So we're panicking about a topic, and what is Sunday?
Mother's Day.
What were we thinking?
Oh, mothers.
Yes.
Speaking of mothers.
Oh, mother. Yes.
We have a chocolate lab that is currently here, and she's got 6 or 7 babies getting ready to pop. Yeah, like right now. She's due on like Friday or Saturday or something.
Yeah, the 14th, Tuesday. I think she's actually due Tuesday.
She's actually due Tuesday, but you can see her little belly's really wide, and she walks with a little waddle. No. She's here in the building right now, but she's APC is our what's the term for
our
births things?
Wet nurse. I don't know.
I don't know. So APC works sometimes with one of the breeders that we work with, and she helps deliver the pups and stuff. And
What is it called when you don't go to the hospital and you have somebody help you?
Midwife.
Okay, yeah.
Is that right?
I think maybe. I don't know.
I whispered it as if you wouldn't be able to hear me.
Or it would make it any less wrong if it was wrong.
True. Yeah, if I whisper it, then it's okay.
So she's our pet midwife.
She's our pet midwife. Yeah, she delivers for the chocolate lab little puppies. But yeah, her name is Min, and she's the cutest thing in the world. She's such a sweet girl.
So, side note, Harrison, we cannot see the thingy on the.
Yeah, no.
All right. You just let us know if anything happens. So if anybody's out there listening, send us some. You don't have some comments, some questions. We'd be happy to answer those as we're talking through topics today.
Why don't you? Okay.
I don't know.
Oh, you need assistance?
Yes.
Okay.
You can.
Let me help you with that.
There should be an automatic login for the Facebook there if you want to put it on there. Which
one can I do? This one?
Yeah, sure. Why not? Also, this week Richie is out of town.
Yep.
He is fly fishing with my brother-in-law Jim Callahan, and so they are in Colorado fly fishing and having a great time, except for that it's snowing, and so they're a little bit cold. It's snowing there. They were supposed to last night get like 3 to 6 inches of snow, so they're not in the water fishing today. They're learning how to tie their little flies, I think, or something like that. So, oh my gosh. Okay, that's can you just take the volume off? Okay. So it's just really funny because they're gone and I'm having to.
So you have to function all by yourself. Hey, tell us about the sugar glider incident.
Oh my dear Lord.
What happened?
Okay. First of
they're
all,
okay. Let me start with
no one has died.
Were harmed in the making of this story.
There no one's dead. So I have 5 children. Holden is the 3rd oldest. He is certainly probably maybe the funniest, and the funniest from the standpoint of not intentionally funny. His mannerisms are
He
funny.
doesn't know that he's funny?
I think he now knows he's funny because we laugh at him, but he has mannerisms. We call him, he has ninja hands. So he's always walks in a room and he's like, what are we doing? So he goes like this, okay? And he just, his demeanor is just, he just makes you laugh. And so I had somebody come in the house yesterday to help me, clean the house or whatever. And super nice lady. And I said, can you, because I'm by myself, so I work from like 7 to 6, sometimes later. And I said, can you
Let's
please...
be real, it's always later.
Okay, it's always later. And, I said, can you please let the dogs out and let them back in? Then I wouldn't have to figure out how to get somebody else to do that during the day. And she said, sure, no problem. Well, I have a German short hair pointer.
Yes.
Who, if anybody understands that breed, is just always on alert and thinking.
Yes.
So she's aware that the sugar gliders. Yes.
Sorry. Caitlin Targart said, so excited for your videos and podcasts. Miss you guys.
Oh, we miss you
thanks,
too.
Caitlin.
Oh, it's so nice to hear that she's watching.
Yes.
She was so great. She ran the kennel. She did awesome. Okay. Side note. All right. Okay. So, when we had a kennel. Okay. Anyway, backtrack. So Winnie, German short hair pointer, is a hunting dog. And so her nose is like just, awesome at what she does. So she knows the sugar gliders are in the house. She does not know where the sugar gliders live necessarily, although now she's figured it out.
She knows now.
She knows now. Yeah, for sure. So Holden asked for these sugar gliders. He wanted something that he could nurture and love and hang out with at the evenings.
Say their names.
The sugar gliders. Holden named the sugar gliders Rio and Toast.
Rio and Toast.
Yes.
I love it.
Which is that in itself is funny. Okay, so for a guy. Okay, so he has the sugar gliders. He's been bonding with them. Everything's going great. They're in a cage and all that. Annie's in the house cleaning. She leaves. She lets the dogs in and out. However, she must have left the sugar gliders door open, Holden's room door open.
Oh, no.
Oh, yeah. Winnie's like, this is fantastic.
This is the best day of my life.
I am certainly not going to tell you that you did that. So Annie leaves. Johnny then comes home at about 5:15 after track practice and sends me a text and says, there's something all over the floor. I have no idea what it is. And of course I'm like, what the? I just paid to have the house clean. Like, what the Sam hell's happening? And he goes, I think the dogs got into something. And I said, what are you talking about? And he said, well, I came in the house and Holden's door shut, but Winnie's in Holden's room. And
like,
I'm like,
what?
oh, no.
Did your heart drop?
Oh, yeah. I was
You're
like,
just like,
oh,
the sugar gliders are dead.
they're
and
dead.
Winnie's a murderer.
Toast is really toast.
Toast is toast.
And so the door, anyway, Winnie ended up going in the room. They're on a cage with rollers. So she ended up messing with the cage, but she went in there because there's all this sugar glider food in there. So like you feed them pellets and then you put this gravy on top of the pellets. Well, the gravy, I know it sounds lovely. The gravy comes in bricks and you have to like warm it up in water and then
gross.
Yeah, it's awesome, but it's smelly too. And then there's all this dried fruit and all this stuff in there, so it's all over the floor.
Oh, she didn't even lick it clean, and she just
ate
spread
it
it across
all the bags and all of the powder parts of it.
I would be so mad.
All over the floor. And Johnny said, I checked the gliders. The gliders are fine because Holden was very smart and he put an eye hook on the cage. So the gliders, there was no harm done to the gliders. So that evening I'm talking to Holden and he's like, he's just so funny. He's sitting down. I made him dinner. He's got a big race today, county championships at Garin. And so he's running today. And so I'm like, got him some pasta and he's eating and he sits down and he puts his hands down and he goes, it is so difficult becoming an adult.
Yes, it is.
Because he's like all sugar.
You don't even know yet.
He's like all of his hands go like this. It is so difficult becoming an adult.
Yeah.
And I'm like,
You're gonna do this
it's
a
like,
lot.
it's really hard. I'm like, it's so difficult. And he goes, well, because all the sugar glider food's gone. So he's going into his bank account. So he's sitting there while he's eating. He's using my computer. He's getting into his bank account. He's got to order more sugar glider food. I said, I'll buy the sugar glider food. It was Winnie. She messed it up. And so he's looking at his account. While he's looking at his account, he realizes that PlayStation dinged his account on an automatic payment for $19.99.
Uh-oh.
And he's like, oh my God, PlayStation just hit my account for $19.99. And I said, yeah. I said, those automatic payments, man, those are like...
Surprise!
Those are really vicious.
They come out left and right sometimes.
Yes, exactly. I was like, I don't even play PlayStation anymore. I don't even know where it's coming from. He's like, oh my gosh, this is so difficult. And I was like, oh dear Lord, child, it's all good.
Yeah,
No
again,
worries.
just wait. So
It's just the beginning.
that's funny.
So he's, learning all those little lessons.
That's good. That's good.
But if Holden, if you're out there, good luck tonight.
He's gonna do great. Okay, my mom responded while you were telling me that story.
What'd she say?
My mother said, Why do dogs lick their paws so much? And is it okay to feed a dog a raw carnivore diet? So I know we've touched on the raw diet before, but maybe specifically carnivore? Just straight raw meat?
Just straight meat, man.
No.
No.
Don't do it.
No, don't do it.
E. coli, salmonella.
Yeah, I mean, they really are starting to push the don't feed the raw diet, basically. You know, that's the word on street.
Word on the street. Why else can't you? Like, why as a veterinarian would you say no?
There's a couple of reasons. One, the contamination to the family, so you have to be really careful. Also, the meat that's harvested for the raw meat diets, typically is going to contain some type of contamination. So then for the pet's sake as well. And then you also have to have certain nutrient levels, you know, so it can be really difficult to obtain certain nutrient levels. So basically, and it has to be done like just the right way, and it's pretty labor intensive.
Yeah.
So they've come out with like that right now the push is really don't use it if you don't. I mean, if there's just don't recommend it is what they're telling us.
Because it's so hard to get right.
Yeah.
Yeah.
So
yeah.
Good question, Patty.
Yeah, that is a good question. So just don't do it.
Yeah.
I still think that I'm trying to get her to still get another pup.
Oh,
you can do it, Mom. She's all like,
right now.
They're pupless.
Sunday is Mother's Day,
and we're gonna get Mom a Mother's Day puppy.
Yay! She's
You know, my dad retired, and I was like, just wait till she has to spend more time with my dad, and then she'll be like, someone get me a dog. Just kidding.
Oh my goodness. So yeah.
No, he's enjoying being retired. I think he's just gone golfing all the time. So
that's good though.
That's what you're supposed to do when you're retired, right?
Yep, that's right. Do some
so
fun things.
yeah.
So then one of the dogs puked this morning on the only piece of carpet that I have in my main level.
Naturally, they always go for the carpet.
Oh, I mean, like always. I'm like, there literally is. Harrison backed me up on this. 95% of hard flooring.
Yeah.
And there's.
I've been to your house.
Yes, one carpet.
One square.
And she picked the square.
Of course.
I knew it was though because it had peas in the vomit, so it must have been pickles.
Yeah.
So
pickles.
We blamed Winnie for everything, but maybe Winnie just, got everything down, and Pickles was like, "Back up, it's mine."
Yeah,
and
I would 100% see that happening.
Yeah.
Pickles is a little vacuum.
Yeah. So she vomited. I have no idea what I'm going to come home to later.
Yeah, that's going to be really exciting.
I left them at
My
7
dogs were
this
perfect
morning.
angels last night, in case you were wondering. So, Nala, I was reading my book in bed, and I was kind of half propped up. So I was laying kind of down, half propped up, and I had my book in this hand, and Nala was being my little spoon in this arm, and she had her head resting on my arm, just snoring away, while I just petted her belly with this hand and read my book in the other hand. And Eric came home and was like, "This is ridiculous." I was like, "Right? The cutest thing you've ever seen." Like,
I'm sure.
Nala was like, just snoring away.
Oh gosh.
Yep. Wilfred doesn't cuddle with me that much, but when he does too, he's pretty cute. But
yeah, that's
they were
awesome.
so good last night.
Sometimes they're really cute to look at.
Nala knows it too.
And then you that's when you you fall in love with them all over again because they're so cute.
Yep.
You're like, oh yeah, I love them.
She just looks at me. Yep.
Yeah. The 2 sugar gliders after yesterday, I went in and opened their little bag. They hide in pouches.
Hey, hold on, we got a question.
Oh, yes?
Sorry, from Marcy Yoakum.
Yeah.
Puppy Theo losing baby teeth daily. As in 5 this week, bleeding quite a bit. How do I stop from getting everywhere? Try to drink of water.
Oh, yes. Marcy is a golden retriever, and he's beautiful.
We were just talking about baby teeth.
Yes, and I don't know if there's much you can do to keep the So, Marcy, I guess I'm assuming you're asking about like the discharge from the teething
Because he loses the tooth and then it bleeds a little bit.
Bleeds a little bit.
Can you do? This is probably a dumb idea. Ice cubes.
Yeah, you can do some ice cubes, like maybe just to like provide. Usually the bleeding stops within, like even when we extract them, we extract the baby teeth. I mean, the bleeding stops within 15 to 30 seconds at most.
Yes, but
I think she's asking it's like as a quality of life, like she said 5 this week. So like.
Oh, that's pretty normal though, because
no, I know, but like if they lose a teeth, like she's like, oh, there's gonna be now. I don't know how to deal with this. There's gonna be blood everywhere. But like, what's the like, you know what I'm saying?
No.
No. Just, like I think she's asking what Is there a better way to make it so that blood doesn't get everywhere when teeth?
There isn't. Although Rhonda Kyle does have a bib on her dog. So if you're talking about blood getting everywhere on your pet, they
If
make
he's a golden
these,
retriever, he would be hairy.
he'd be hairy enough, and he was a big puppy to begin with.
Yeah.
So now at this point, he's probably even bigger. They make these kid things that you just slide over your head. They're actually for kids. I mean, and that way it's not like, when you use a bib, they would have the Velcro.
Yeah.
Well, this is just like all cloth, and it's a hole in a piece of cloth.
And you
basically,
just
you
slide
slide
it
it
down.
over. So that's what Rhonda Kyle uses.
Can you put a little tray under
course,
it so it just
Catch
catches
the
the
drool
teeth?
and the teeth and the teeth.
Catches the teeth and the, yes, we'll just collect them all.
However, it's a golden retriever. He's going to eat it. So don't do that.
That's
Bad
disgusting.
idea.
Yeah.
He's going to eat the
He
towel.
might. He's gonna eat the towel. So, ice
Ice cubes for treats.
just for fun
and then restrain him into an area
into
that
a
you
room
could
that doesn't
clean.
have a small square of carpet in it.
Right. Exactly.
She said, OMG, a bib.
A bib. Yes, exactly. A bib. And then the bleeding will just stop on its own.
Yeah.
But-
Eventually.
Those baby teeth, so they've got 6 incisors on the upper side, 6 on the lower, and then they've got their canines.
Yep.
So my guess, based on his age, off the top of my head, is he's losing all of his incisors. His canines aren't falling out yet. So he's going to drop all those incisors over a week to 2 weeks.
He's got 5 of the 11 already gone.
Right.
That we know of.
Right. So he's going to drop them and move on. The canines, Marcy, aren't coming out until like 5.5 to 6 months of age. But you won't see a whole lot of bleeding with those. Sometimes with the premolars when those start to drop.
Yeah. Premolars for sure.
Huh? Yeah. They usually have all of their adult dentition by, I think it's like 7 to 8 months of age.
Yeah.
So,
But
those
sometimes they have a couple teeth that stick behind, and then they have 2 teeth, and we have to
remove them.
remove them. We have to remove the baby tooth. We leave the adult tooth.
So yeah, because we were just talking
That
about that
happened
today.
all day today.
Well, we had a little Chihuahua, and she didn't drop all of her teeth, so all of her adult teeth came in, and then she had retained baby teeth.
She looked like a little shark because she had like her adult teeth, and then her baby teeth were just like sitting right on top.
And so it causes, if the adult tooth doesn't push out the baby tooth, then you can get irregular, like where they come in, so then it can change the bite. So like even on her canine tooth that had the retained deciduous tooth, there is some movement of, that's my message thing, just ignore that, I don't know.
Oh.
Like where the canine tooth is moved in, so it's not in the right position. So you get malpositioning with the...
And then also
Carla, are you listening? Carla
yeah,
Cloud?
Carla. And then I think also with the deciduous canines, because it's like one stacked here, and then the other one's kind of almost like at an angle away. They get a bunch of tartar and crap built up.
It's almost like cement between the teeth.
in between the gap. So if
Yeah.
you don't remove it in time, then it will damage the adult tooth as well.
Yeah.
Which is why it's important for us to take it.
Yeah, so our little Chihuahua today, she had that. We took those out. She also is missing adult teeth. So adult teeth didn't come in. So she didn't, all of her adult teeth did not come in. So now the question is, where are they?
Yeah.
Does she
Are
just
they truly not there, or did they not erupt?
Right. So then, I got stuff all over my face, I feel like. So then we are going to...
Are you okay?
So we're going to do a dental on her in a year, and then we'll x-ray her, and we'll be
check
able
him
to
out.
see.
Wilfred was born without some of his bottom premolars as well, and after doing his x-rays, they're truly just gone.
They're not there.
But the problem is that sometimes you don't think that they're there. You take the x-ray, and then they didn't erupt, and then because they didn't erupt, they can cause like
These
cysts and stuff later, and then
that can be
cause all
bad.
sorts of other problems in the jaw and stuff later.
Yes, very big problems. That's why we go back around and take the pictures.
Yep.
So you would think like, oh, they're not there. Who cares?
Who cares?
But you got to go look.
Sometimes they stay dormant for a
yeah.
little bit and then awake later.
Yeah.
Yeah.
So it's crazy. Dental disease.
Dental disease.
It's actually very interesting.
All right, let's go let's start with our listener question, which will segue us into another topic until we have another one. What?
It's a nice job.
Thank you. Nailing it. Please explain why Caitlin is your favorite coworker.
Who is that saying that?
Caitlin Shaw.
Caitlin Shaw.
Please explain why Caitlin is one of your favorite coworkers, or what is your favorite coworker. That is funny.
That is hilarious.
We do really enjoy working with Caitlin. Everybody here has a really good time working with each other.
Oh my God,
so
that's hilarious.
thank you, Caitlin. That was hilarious.
We have multiple Caitlins. Maybe that's why we were like Caitlin, because just the name Caitlin. Like anybody named Caitlin.
We've got Katie, who's actually a Caitlin, Then we have me, Katie, who's actually a Caitlin. Then we have Caitlin. Then we have Christy. Then we have Christina. And I think that's
a lot.
Katie, Caitlin, Christy, Christina.
Oh, gosh.
So much fun.
Yes.
Okay.
So, Caitlin, I think you should be working. Why are you listening to the podcast?
She's on lunch, if I remember correctly. I saw her
I'm
right before
just
I came
ribbing
in
her.
here, and she was all like, I'm off the clock.
I'm
Wouldn't that be
ribbing
funny
her.
if she was like, haha, oops.
Right.
I was never here.
Oh,
Or
gosh.
haha, don't tell Biddles.
Right.
Okay.
Oh, goodness.
So one of the listener questions that we got beforehand was,
Yes, Harrison, it was.
oh my gosh, it just slipped my mind.
Do pets get stressed when they're hungry?
Do
Oh,
pets get stressed when their owners move?
Yes.
The answer is
Yes.
absolutely.
Yes.
So, and it doesn't matter if you are, and it also, I'm going to make this like two parts. It doesn't matter, like the pets get stressed when you move, but the pets also get stressed when you change up their routine, even if it's a place that they go to all the time.
Right.
So,
And you just have to, you can just move across town. You don't have to move.
Move. Yeah. Like my mother-in-law has to move her like year-old chocolate lab 20 some odd hours to Florida in like 5 weeks.
Right. And here's the other thing. Like it's your old house because say you're 23 and you have some Goodwill furniture. And so you're like, whatever, sit wherever you want, And so the dog sits wherever he wants for 7 years.
Yep.
And
Now you're 30, married, kids.
And you're like, I need some nice furniture. I'm moving up in the world.
Yeah.
So you buy some nice furniture from
IKEA.
And so then
Yes.
you get it to your new house. And you're at your new house, you're like, you know what? I don't know if I want my dog sitting on my nice IKEA furniture.
And now it's too late.
Penny Meyer left you a comment.
What does your dog think of that?
What does your dog think of you not allowing it on the furniture anymore? Your dog says, yeah, that's hilarious. I'm going to do it anyway.
Right, radio. And so the owner
What do you
then
mean I
says,
can't get on this couch? It's funny.
Right.
Good one.
Good one. Yeah.
You're funny now.
I think you're, I think you're losing it up there.
I don't know what happened to you, but this is we're done.
Right. Just open the door. I'm leaving. So the owner then says, the now 30-year-old goes, this is an easy fix. I'm just going to get you a cage.
Yeah.
So I'm going to have a cage. I'm going to actually, put it over here in this nice room. And I can when I leave, I'll just let you in the cage. You can just have the cage.
It will be yours.
And what does he think of that?
This cage is not okay. I've never been here before. What kind of an animal do you think I am? And who do you think you are?
Exactly.
Get me out of here.
Pause. Penny Meyer said, love you, Dr. King. You and your staff are the best.
Oh, Penny
Love you, Penny.
Meyer. Love you too. Oh, she's so nice. Yes.
So anyway, some things to help the stress when you are moving would be hope for the best. No, I'm just kidding. It depends on really how stressful they are. So in my experience, what we had with my two dogs, when we've moved, we've basically put them in their kennels while we move all the big stuff, and we left them in the old house until the new house was
Put together.
just about put together.
Right.
So that they didn't have to go through moving things twice, right? So we just kind of let them hang out in a room by themselves while all the big stuff was taken in and out, in and out, in and out, in and out. Go to the new house, then take them to the new house. And then at that point, because most of it's been I'm not talking like I've put the dishes away and I've hung my clothes up. I'm talking like the couch has been put in the living room.
The right spot. Yeah.
The boxes are now inside. At that point, I bring the dogs over, and then I'm able to like spend time with them and let them roam the house, and then like, hang out. So I kind of approach it so that they come last, and then I'm available enough to watch them and be with them.
Right.
So, yeah. Otherwise, like you can do any sort of like an anti-anxiety medication to help if they're really freaking out.
Mm-hmm. Yep. We do use drug therapy sometimes in
Yep.
them just to allow the experience to be better.
Yep.
Not that they have to remain on medication. Penny Meyer has a dog, Hendrix, that we've used meds on before that was different, like for nail trims and things like that. But what we did was acclimate that dog over time to the process of what was
Yes.
happening. And now he doesn't need anything.
Yeah.
You can touch his tush and his feet. And
His tush and his feet.
he's perfectly fine with it.
Perfectly fine. That's
So,
good.
so same thing happens when you're at home, I mean, in your moving, you can use drug therapy to create a better experience so that, there's not the separation anxiety component, or you don't create a problem.
Yes.
So I think one thing people forget about dogs is they're completely self-motivated. They do not care about people. Sorry for that buzzkill, but they don't really care about us. They only care about themselves.
Yeah.
So they only do things that are good for themselves.
And they only really want to cuddle with you and give you all of their undivided attention when it's close to breakfast or dinner.
I don't know.
That's when Nala is attached to my hip. It does not matter what room of the house I'm in. She is like on my tail, just like give me the biggest puppy dog eyes.
Yeah.
And then I'm like, oh, that's why it's dinner time. That's why you're following me around.
That's why you're following me around.
I mean, she follows me around a little bit, but.
So yeah, just don't switch things up too fast on them.
Yeah.
Because it can create a lot of problems.
Yep.
And then you end up having to untrain. Untrain is a lot harder.
Yep.
So I would say forward thinking, if you're thinking about moving and maybe their situation's going to be different, their setup's going to be different, then almost like pre-training for those scenarios.
Yeah.
Because most people don't just like drop and move in 24 hours. So you know it's coming. So you can start to acclimate the pet to different things they might be exposed to or different situations.
Yeah.
So like if you're now going to be working and you're leaving, maybe you start leaving now, getting them used to that type of change in routine or whatnot.
Would you think it would be beneficial if you like know where you're moving to like go to that neighborhood and take walks through the neighborhood a couple weeks before or something?
Oh, it doesn't hurt anything.
Doesn't hurt?
Yeah.
I don't know if that would even like if it was beneficial or not.
Yeah, I mean it doesn't hurt anything.
So cool. All right, so that will then segue us into another topic. What are some signs of anxiety?
Signs of anxiety. Oh, there's so many.
Yeah.
Okay, so destructive behavior.
Yep. Shredding things.
Eating things
they don't normally eat.
Yes. If you shut a patient, if you shut a pet inside a small space and then they're chewing at the door frame or the drywall.
And they don't normally do that.
Barking.
Mm-hmm. Pacing.
Nervous
panting,
yes. If you are working with a pet, like you're actually trying to do something to them cowering, moving away from you,
tail between the legs,
won't take treats.
Yep.
Signs of anxiety.
Almost like dropping to the floor a little bit, but not quite.
Mm-hmm.
I don't know how to describe that one. Wilfred always gets this really weird like cry where he's like and you're like it's definitely not singing.
It's like vocalization.
There you
Yes.
go. Gosh, he was doing that yesterday, and I'm like, my neighbors are all outside, and I'm like, Wilfred, shut up, Wilfred, what are you barking about? Like,
aimless wandering or pacing. So
Yep.
yeah, like you were mentioning, like they'll just circle.
Yep.
Yeah, I'd say those are probably the most common, maybe.
and that can go for the moving situation, for any change of environment. You didn't have children, and then you brought a baby home from the hospital, and you got another cat and another pet.
Mm-hmm.
There's really weird people that are coming over at all hours of the day. Like,
anything that you can do if you do have a baby and like your pet is like very hesitant and like ends up not like really?
Most of them, you really hardly ever have any trouble unless the dog had issues with aggression to begin with.
Yeah.
I mean, you really are never going to have trouble with a dog not liking a child that's within the family, only because you got to remember the child comes in and it's not movable. It's not moving. It's not following the pet around. So the pet's allowed to have access, but can get away very easily. If you just drop a 2-year-old on the pet, that's a different story because that person's mobile and will chase them down
Yes.
and cannot read body language of
Yes.
the pet. So that could potentially be an issue. But newborns, I mean, they just acclimate with the child. So as the child's growing, the pet's getting used to the child. The child then becomes a feeding station. So now, again, because dogs, the way they think, they do anything that's good for them.
good for them. This kid's going to drop scraps,
Yep.
so I'm going to hang out right here and be his
And I like you.
BFF.
Yeah, exactly. So it ends up evolving just fine. I mean,
Yeah.
it's usually not an issue.
And I feel like dogs have the weird sense of like, this is a baby, I should move slow. And I don't know if that's true or not, but I'd like to believe that.
I think they probably do that only from an apprehension standpoint of like, I don't know what's going to happen here. Like, not necessarily from a protective mechanism of the child.
No, yeah,
but
definitely.
just not knowing what, is it going to move? Is it going to come after me?
Is it going to be, why is it so small?
Right. Yeah.
Where's its hair?
right. Exactly.
Where's its claws?
So
I understand.
I think that they definitely know something's going on that's, But some dogs could care less, and then others are very interested because the parents' routine changes as well. So now you're getting up in the middle of the night, and if you have somebody that's like a follower, then they're like, why are we up? What are we doing?
Yep.
Another dog will just pick its head up and be like, why are you?
I have one of each. Wilfred didn't get up until I was like, do you want breakfast? And then he was like, I guess so. And then he came out, he went outside, and then he came back in, he ate breakfast, and then he like didn't even say bye to me this morning, and he just went right back into he sleeps on a orthopedic bed that his grandmother gave him. Eric's mom got them like super fancy beds. And so he just walked back into the closet to go back to sleep. I was like, all right, have a good day.
Right.
Love you. Nala's like, wait, can I come? I'm like, all right. We got another question from Penny. It's not a question. We are using essential oils on Hendrix made for dogs for anxiety, and it truly helps a lot. Oh, that's awesome. And it's Vitality Extracts. That's where we get some of the ones that for us as well. It's a great company. Oh, that's another topic. Essential oils. Good things and bad things. Actually, well, I don't know that there's necessarily like super bad things other than like tea tree oil is not going to get rid of fleas. Like telling you that right now.
I can bet $1,000 on it.
Bet $1,000 tea tree oil will not cure fleas.
Yes, and also ideally we do not try and subject the pets to the essential oils topically because they can't get away from it. And the whole point is that, and the reason is because they have such a more sensitive sense of smell. Yeah. So if they can't, it's okay to use them as in diffusers or if you want to put it on a bandana that you can then take off. But, they tell us not to put them directly on the pet because the pet can't get away from it. Yeah. So mostly we have a lot more issues of that like with cats because they have even more sensitive than dogs. Yes. And they're known for developing asthma, which dogs don't get. So you can imagine that if you had a reaction to something and you couldn't get away from it, and I mean, he's not going to be like, "Hey, let me wash my feet."
Hey, that burns a little bit. Like he's not.
He
can't tell us
that. So then you end up with a medical condition. Yeah. It's just one of those scenarios where. Yeah.
So I think that if you use them in the diffuser, put them on the bandana, like you said, like that, then like stuff like that, lavender oil. Like I mean, everybody. I don't know who doesn't like lavender oil a whole lot. Like it just. Lavender's just like that calming scent.
Yep.
And that's
what
why
it's for.
Everybody loves it.
But there's a lot of companies that will have information on pets for their essential oils too. And so that's always good because then you have at least some guidance.
Yeah, for sure. Oh. What are some other common things that pet owners could potentially miss when like their pet's trying to tell them something? So, I know that's a super broad question, but...
Well, things that they should be watching for, or things that would tell you to bring your dog in for like if something's wrong.
Something's wrong.
So let's see here. The big ones that we talk about would be change in behavior, drooling, because they just don't drool. I mean, like, okay, if you hold a treat in front of a dog, it might drool.
They're gonna drool.
Like not drooling.
Other than like a Saint Bernard and stuff that just like are naturally super drooly, but like otherwise.
Yeah, like faucet drooling.
Like just.
Yeah, so change behavior, drooling, and increased thirst.
Yep.
So if you have pets that drink a lot, that historically they've had an average amount of water consumption, but now
all of a sudden you're like, dang, I filled your water bowl 6 times today.
Right. There's a lot of diseases that we see that are more common diseases that will cause increased thirst.
Yep.
What else?
Hiding
for
cats.
Yeah.
A little bit more for cats hiding.
Yeah, cats are tricky because they're silent sufferers.
They are. So if they show signs of weakness in the wild, they're dead.
So they really don't show disease until it's too late. That's what's so important about bringing them in on a regular basis. Yeah. We use their vaccines every 3 years. So that's the disadvantage of that. Clearly it's the better medicine, but the disadvantage is a lot of our cat owners then don't necessarily see the value in bringing them in yearly.
Yep.
When in actuality, there's so many things you can catch on physical exam that you can preemptively, kind of get between before things get really bad for cats. I mean, the majority of our cats that we treat that are sick patients are 13 or 14. They haven't been to a vet for
10 years.
Right. And so then they are, on the other side of the fence,
Yep.
it is really hard to back that bus up and
Yeah.
say, okay, well, now let's do this and do this. You can imagine how hard it is to medicate cats.
Yes.
So, the more we see them early, the better off we are.
And I think another common thing that it's not abnormal to see, but people don't really notice that it could be a symptom of something, is if they've got painful teeth or dental disease that's bad enough, and they didn't used to drop food.
Now dropping.
And now they're picking up food and then throwing it out, dropping it, and eating it more of like one piece at a time.
Sure.
Naturally, you would just be like, that's funny. They want to separate their food now. Like,
Right.
But that actually can be a sign that there's painful teeth, infection, potentially dental disease. So,
Yeah.
yeah.
I'd say, a lot of cat owners don't bring their pets in because they're so hard to bring in.
Yeah.
So there's
And their
things
cat,
that
it takes 2 days to get them in the carrier.
Right.
It takes their pet's obviously stressed out, vocalizing and upset and anxious to even get here, which makes the owner upset and anxious. So it's just more of a hassle to bring them in.
But I think the industry has evolved a lot with cats and trying to manage them fear-free to allow owners to not have as much anxiety. So, for instance, like now we use meds on them. So, like we would rather over-treat somebody from the standpoint of maybe they don't need something like gabapentin before they come in, but certainly isn't going to hurt them.
No.
And if it creates a better experience for all parties,
Yes.
then great.
Yep.
You can get way more information from a willing patient than
Yes.
somebody who's, going
For
to eat
sure.
you or run away or
Yeah, and we're working on, it's not cat fear-free. What is it? The
Cat-friendly.
Cat-friendly certification, right?
Yeah, I think it's pretty much done.
We're almost done with the cat
Yeah.
friendly certification so that we can better
Shout out to Dr. Fast.
shout out to Dr. Fast so that we can better care for our feline patients. So like for example, cats get really stressed out when they come to the vet and there's like 30,000 dogs barking around them and stuff. So we have our own separate cat room. And we have an exam room designated to cats so that they have less interaction with dogs visually, but also like smell-wise.
And they have little hiding spots in those two rooms.
Hiding spots,
And,
yeah. And we call the cat room Cat Mountain.
Cat Mountain.
Get it? Because it's a meowton. Cat Mountain. What do you call a pile of cats? A cat mountain. That's where I got it from. That's a funny joke.
Cat Mountain. Yeah, we have names for all of our stuff
We do.
here. So that's kind of become a tradition.
We've got Cat Mountain, Faust Island, Dudley's Cul-de-sac.
Yes, that's true. That's
new.
That's fairly new.
And I would like to point out that I came up with 2 of the 3. You're welcome.
No, and then who came up with the isolation for
Isolation is 2319 from Monsters
Monsters,
Inc.
Inc.
2319!
So that is now the location. Isolation is
Our
2319.
isolation ward. And isolation is used for pets that we think could be contagious. So naturally, it's almost like a pet quarantine just to protect everybody else in the hospital, pets and staff. So that's why we have an isolation. Not like you're being bad, get an isolation. You know, like
I didn't even think of that.
Right?
That somebody might think that. Yeah.
maybe. So yeah,
Yeah,
2319 for
2319.
potentially contagious patients from our Monsters Inc. But
Yeah.
who did come up with that one?
I think that was Caroline.
Caroline?
Caroline and Elise, or both of them. I
Caroline
can't
or
remember.
Elise. So yeah, kudos. Yeah.
So those are some of our locations.
The door's literally labeled isolation 2319.
Yeah. So I just keep waiting for Sully to come out of the door
Solely.
from Monsters Inc.
It's a beautiful day to get out and wake up, Sully. We gotta
gosh.
watch that. It's been a long time.
I love that movie. It's one of my favorite movies.
Oh my gosh, I will never forget the intro scene where the alien like slips on the ball and lands on the jacks and like runs around. I was like crying. I was laughing so hard.
Oh gosh. Okay.
It's so good.
So back to other reasons why people should bring their animals to the vet if they see something at home. Can you think of anything else that
The dental one
things that
for
would, 'cause
sure.
That's a really common question that I'll get in a room is, I guess I really didn't need to bring him in today. And I would say that, one of the sayings we always use is 1 peek is worth 1,000 guesses.
Yes.
So, we have no problem. We feel much better if we look at something and
we
it's
know
nothing.
you can rule it out,
And it's
yeah.
nothing than to, have the worry of, it being an issue or things because they progress so rapidly in
Yes.
pets, then we're 24 or 48 hours down the road. And
Yeah.
so, we, just call and ask. We're happy to
It's
advise
better to be safe than sorry. I would think I've got one more, and then we should move to funny videos.
Okay.
One more common thing that I hear occasionally is, he vomits after every single time he eats, but it's really not that often. And you're like, well, still not normal. Do you vomit after every meal? Like, not. You know what I mean?
hope
Like, not on, unfortunately, some
I know
diseases,
Yes,
but you know,
yes.
like, you don't just like, oh, I'm gonna regurge now. Like,
Right.
So that might be something to look at as well.
Yes. So GI symptoms.
GI symptoms:
Yes.
vomiting, diarrhea. It's not normal to have diarrhea for like 6 days. One in a blue moon, you might
That's
maybe
pretty normal.
But like,
or when you eat a crap ton of sugar glider food.
or when you eat a crap ton of sugar glider food,
You
okay,
could
that's
definitely
pretty
have
typical,
diarrhea.
too. Yeah. Okay, funny videos. Unless you have something else.
No, I'm
Nope.
good.
Let's
Funny
do
videos.
it.
Hit us, Harrison.
Gonna watch the funny videos. No more from my mother. Uh-oh. Is this dog gonna jump all the way up that wall?
Here we go. So I told Katie that I've been accumulating videos these past 2 weeks,
Okay.
and there's a lot of them. I have like, not in this one, like I can stack up like 3 episodes. I have like 50 or 60.
Okay,
was
so
gonna
we're just
say,
doing
can they
like
see?
4 or 5 today.
There's like 10 or 12 here.
10 or 12. Okay.
10 or 12. Here we go.
I don't know if this one has sound. It should. But
All right, so this guy. Oh my gosh!
That is amazing. Do they show him getting up there?
That has got to hurt that guy's back, first of all. But this dog literally runs up the side of a wall.
I mean, that's got to be, what is he? He's probably 5'10", 6 foot. So then that's 12 feet, 15 feet.
That's got to be 15 feet. Holy. I want to see him get all the way up.
At the very end, you see it. So he's jumping off the guy's back, up a cement wall.
But
and
he
then
like, I
grabs
mean,
the
like he gets
surface.
all 4 paws on the wall and like he's running on the ground. Like all 4 paws land and then he just keeps running up. That is crazy.
Penny Meyer also commented again.
She said, okay, this is my last post, LOL. Only put essential oils on a dog where they cannot lick them off. Their website has lots of information on this and which ones you cannot use. They have roll-ons that are pre-mixed specific to your pet's needs. There are some you should never diffuse around animals. Oh,
Good job, Penny.
Yeah.
Thanks for clarifying that. Helping
thank
us
you.
clarify
Yeah,
that.
that's good. So yeah, if you're gonna use essential oils on your pet, use this pet specific ones and read the instructions. I like it because I take lavender on myself and I'm like, meh, 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 you know?
Then you're a limp noodle. all day.
Yeah, lymph noodle. All right, here we go. Another one. Says wait for it, and it's a cat trying to climb up. Oh no, it's a ferret.
Get off of there.
Oh my gosh, this ferret's trying to climb up this cat house, and this cat was like, nope, not today.
Not today.
Literally grabbed it with its paw and threw it off. That's hilarious. Nope.
They even added sound effects.
You can do it mean.
Oh,
Is that a sound effect? Yeah, nice one, Tom. Remember that? That's a good
we
one.
do need a shirt for the nice one, Tom.
What, I can't sneeze?
What, I can't sneeze now? Nice one, Tom. Oh,
The cute
goodness.
emergency? What?
Okay. Oh my gosh, that little patient. Look how little.
When I hear that dinner is ready. Oh, this is going to be good. Caption is when I hear that dinner is ready. And this little puppy, oh my God, it's a baby corgi. The baby corgi just starts hopping across the carpet all super excited out of nowhere. That's pretty cute. Very cute.
That was very cute. Oh, it's a dachshund.
It is cute.
But
A dachshund's playing the piano.
and he's singing.
Oh my gosh. He's hitting the piano key and then howling right after.
Oh my gosh, that's cute.
That's
He's
adorable.
pretty much on pitch.
Pretty much on pitch. That's pretty good.
All right, Harrison, we
Pretty
have time
good, buddy.
for one more because of Katie Ray's schedule.
We can do like 3 more, but we'll have to move just a smidge faster.
New song for National Pet Day.
New song for National Pet. There's another beagle playing a piano. And he's wearing a bow tie.
Look at his tail wag.
He's playing the piano himself while wearing a bow tie. That's the cutest thing ever.
Oh my gosh. He hits his own piano keys. That's cute.
pretty cute.
Rapid time.
Here we go.
Dogs loves running in a bath. Okay.
He loves running in the bath.
Oh my god, he's got bubbles. So this is a little French bulldog in a bubble bath. And he's playing with the bubbles and running. Oh my gosh.
It's a Frenchie and he's just stomping the bubbles. Ah, they're all over his face.
Okay, we'll see you tomorrow for corneal ulcer. All right.
Yep. We'll see you tomorrow for corneal ulcer. That's, yeah. No, I don't think so.
Okay, so there's a video of motorcycle racing, and the cat is watching on the TV. It's a pretty big TV, and so he's like can see the whole thing.
Yeah.
He reaches up as the motorcycle's coming around the corner. He's leaning into the corner, and he just like pulls the motorcycle. Well, I mean,
He smacks the TV, but it looks like he pushes the motorcyclist over. So it's like perfect timing. He smacks the TV and the motorcyclist falls over.
Oh my gosh.
The motorcyclist appears to be okay. In case anybody's just watching.
anybody's worried about
He's
that.
not. He does not appear to be injured, but that's funny. Is this a little tug of war? What's happening? Oh my gosh, he is not letting go. Oh my god. Ah.
Oh goodness.
This dog has a toy and they're trying to play tug of war, and the dog's just ferociously either shaking his head or the owner shaking his hand to somebody. I don't know. That's funny.
Serious
case of the zoomies.
What?
Zoomies. Oh,
like-
little baby.
The eye thing is hilarious. He's like, what are we doing?
He keeps coming back to shove his face right into the camera and just like one eyed open, like, burp.
He said, come on, we're going over here, right? That's the door.
The little zoomies.
Oh, that's cute. Look into my eyes and tell me what you're
The
seeing.
one eyed, like,
Right there. That's so awesome.
That's funny.
All right.
Whoa, Frenchie.
Ready? Hold on, we have one more.
Last one. Okay.
Or this one and then one more and that's it.
Okay. Oh my gosh,
Oh,
he
it's
wants
another
to
French
box.
bulldog. Hit me.
The Frenchie wants to box.
Oh, that's so cute. So he's
That
got
is
a dummy.
adorable.
He's punching the dummy, or she's punching the dummy, and then she's
Last one and then closing.
doing hand work with the French bulldog.
This makes me happy is the caption. Eat the little pity. He's running across. Oh my gosh, he's waiting for ice cream.
She's like, please, 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 please.
The
Her
little
tail-
dancing feet. The dancing feet is one
Yes.
of my favorite things ever.
And her
So this dog is waiting for ice cream very patiently, and she's got the little half sit where her butt doesn't actually come down. Tail's going crazy,
Tail is
and then
going
she's just
100
dancing with
miles
her
an hour.
front feet.
The folks in front of her leave, and then she gets her ice cream.
Oh my gosh, that's so cute.
Aww. That's
I love
adorable.
that. That's so sweet.
All right, so there we go. First live podcast ever.
First live podcast out of the way. Don't break the mic at the end.
Thank you, everybody who participated.
Yes, thank you for
It makes it
your
a lot more
questions
fun for your
during.
questions,
Thank
yeah.
you for watching. Remember that you can catch our podcast at
Facebook,
Facebook,
iTunes,
Spotify, maybe somewhere else. Send us your questions on Facebook. You can shoot them to us at even Instagram, podcasts at all-star-vet.com.
gmail.com.
ASVC podcast
podcast
at
at
gmail.com is where
Okay.
you can send us the questions
Yeah.
and leave us a review. Let us know what you think. What would
things
you
you wanna
like?
talk about?
What do you want to talk about? What do you want to see?
Also, Day in Live episode 5 is out this week.
Day in the
Day in
Life
Life.
episode 5 is out right now. I watched it this morning. It's pretty funny. The VR between you and I, hilarious. It's funny. You were like, nope, going back down. That was so funny. You're like, I'm not doing this.
That was very cool. Yeah. So hopefully you
fun.
guys enjoy the day in the life. Those are Harrison puts those on. They're a
Yep.
lot of fun. You can kind of see behind the scenes a little bit. It's a little bit of everything.
Yeah, disclaimer, you get to see some surgery things, but I
Yep.
think he says that on there. So you can think that's cool or you can think that's gross, but I think it's cool.
Yeah. So
Hence why I work in the surgery department. So
all right. I'm Dr. King, and
I'm Katie Ray.
we'll see you next time.
Bye.